Hello everybody, Dr. Ryan here, board certified specialist internist. Thank you so much for joining us in our final video in the rapid review series. We're taking a closer look at meningitis. If you haven't yet subscribed to my channel, I strongly encourage you to do just that. So what really is meningitis? It is inflammation of the meninges associated with pleocytosis. Symptoms of meningitis include headache, neck stiffness, neck pain, lethargy, confusion, which is usually not really prominent in the initial course of the illness, nausea, vomiting, photophobia, and phonophobia. Physical signs of meningitis include fever, knuckle rigidity, Koenig sign, right, which is basically what happens when you flex the hip and with the knees bent. Then you gradually extend the knee and the patient will have pain radiating down the back as the nerve roots are stretched. Brudzinski's sign is basically flexion of the neck causes flexion of the knees in an effort to diminish the stretch imposed across the inflamed nerve roots. Okay, papilledema and other signs of raised intracranial pressure, like a sixth nerve palsy, the third nerve palsy. Some physical findings may be specific to the underlying organism, like the maculopapular and petechial skin rash of meningococcemia. Encephalitis, however, is inflammation of the brain parenchyma characterized by neurological dysfunction early in the course of the illness. Meningoencephalitis is used to describe cases with clinical features of both meningitis and encephalitis. CT of the head should be obtained before LP in patients who are at risk of the presence of a mass lesion with raised ICP. So if you have focal signs, you really want to do a CT before you do a lumbar puncture. Complications of meningitis can be divided into intra and extracranial. Intracranial patients can have seizures. They can have vasculitis, which leads to infarcts. They can have cerebral venous sinus thrombosis. Those are just to mention a few, right? And then extracranial are things like sepsis, acute respiratory distress syndrome, SIADH, and so forth. So the way we split meningitis is viral, bacterial, fungal, and aseptic. Bacterial further divided into typical and atypical flavors. Viral meningitis has six to really mention: enterovirus, herpes simplex, which often gives you encephalitis or an encephalomeningitis. HIV can also cause it. So remember, protein in the CSF up to 1 gram per deciliter is acceptable in the setting of HIV, as well as a few lymphocytes. Lymphocytic choriomeningitis virus, arbovirus, and mumps. Typical bacterial pathogens are Staph pneumo, Streptococcus pneumoniae, right? Neisseria meningitis, our typical meningococcemia, which gives you the petechial rash. Haemophilus influenzae, Listeria monocytogenes, don't ever forget that one, right? Then Staphylococcus aureus, gram-negative bacilli as well, right? Then atypicals, example, Mycobacterium tuberculosis. Now we need to have a very high suspicion or strong clinical suspicion for tuberculous meningitis because TB is endemic to South Africa, right? And the hallmarks there will be the patient will have protein which is very high, may have a lymphocytic pleocytosis, but it can have a few neutrophils early on. We have a very low glucose, right? So typically your CSF glucose is below 2/3 that of the serum glucose. Okay, spirochetal, they were thinking about syphilis and neurosyphilis. So you want to do your CSF and look for a non-treponemal test on this, either a VDRL essentially, and look at the titer of that, right? Mycoplasma pneumoniae, Coxiella burnetii, Brucella, and Rickettsia. Fungal causes cryptococcal meningitis, especially in patients who have advanced retroviral disease with a high viral load and low CD4. Okay, histoplasmosis, blastomycosis, coccidioidomycosis, aspergillus, and candidiasis. Then we've got the aseptic variety. A couple of medications can cause it. Malignancy definitely. So elephangitis carcinomatosis, right? If that spreads, that can cause meningitis carcinomatosis. Connective tissue disease, especially in the way of systemic lupus erythematosus. Then, of course, parameningeal infection. And if you're looking here specifically at bacterial meningitis, what's the underlying pathobiology? So you got bacteremia, which then causes endothelial damage, and hence we have also bacterial translocation in the CSF, which also mediates endothelial damage. And as a result, you have the release of a cascade of pro-inflammatory cytokines. And these cytokines are one of three things, or all three basically. They increase permeability of the blood-brain barrier, which then leads to vasogenic edema. They cause chemotaxis or leukocyte attraction and CSF entrance, which mediates meningeal inflammation. They also cause cerebral vasculitis, which predisposes to infarcts, right? So it causes the diminished cerebral blood flow predisposing to ischemia, and that then releases excitatory amino acids that also feeds into cytotoxic edema, which together with interstitial edema and vasogenic edema raises your intracranial pressure. With the raised ICP, there's going to be diminished global perfusion, and what also contributes to this is hypovolemia. So you've got diminished global perfusion with excitatory amino acids, and you have neuronal injury and apoptosis. Alrighty. Okay, my friends. The Bible says that one who gossips, that gossip goes down to the innermost parts. It's described as choice morsels, right? Slander and gossip have no place in the life of a child of God, right? And it actually has consequences, and these consequences correspond to the acronym TAILS. So T is tarnishes the body. To tarnish means to corrupt, to pollute, to infect, or defile the body. James chapter 3, verse 5 or 6. Right, so the tongue is a little member and boasts great things. See how great a forest is set alight by a little spark. And the tongue is a fire, a world of iniquity. The tongue is so set among our members that it defiles the whole body and sets on fire the course of nature. It is even set on fire by hell. A stands for anger. Proverbs 25, verse 23. The north wind brings forth rain, and a backbiting tongue an angry countenance. L is a slander and gossip lead to loss of fellowship with God. Psalm 101 verse 5. Whoever secretly slanders his neighbor, him I will destroy. The one who has a haughty look and a proud heart, him I will not endure. E stands for early death. 1 Peter 3 verse 10. He who would love life and see good days, let him refrain his tongue from evil and his lips from speaking deceit. S is slander and gossip bring about sickness. 1 Peter chapter 3 verse 10 declares, for he would love life and see good days, let him refrain his tongue from evil and his lips from speaking deceit. Psalm 27 verse 13. I would have lost heart unless I had believed that I would see the goodness of the Lord in the land of the living. Let us refrain from gossip and backbiting and slander. All right, thank you so much, guys. So this brings an end to our series on the rapid reviews in internal medicine. We covered 50 rapid reviews over the 10 big systems. I hope, God willing, to start a series on OSCEs where we'll be looking at clinical presentations coupled with investigations and results of investigations and management in an OSCE format. Thank you so much, guys. Looking forward to seeing you then. Take care.